and it hit homes. It hit many of our homes. Cancer, stroke, diabetes didn't feature, etc., etc., is something that we as a country continue to grapple with.
For his part, the head of department, School of Public Health under the School of Medicine and Allied Health Sciences, Dr. Raskew, also expressed gratitude to the officials of the University of Iowa for their long-term commitment to supporting the University of the Gambia. He maintained that with support from world-class universities, specifically the Iowa University, will help students of the UTG to become creative researchers, and prayed that the cordial tie between the two universities is strengthened forever. For the students, the initiative is going to go a long way in helping them tackle some research constraints. Jama Sow, the president of the Public Health Students Union at the UTG, expressed great delight at the project and other interventions from the Iowa University. Professor Lawrence Fortes of Iowa University told the state broadcaster of his university's readiness to work with the UTG.
The students, the faculty, the administration you have here is exemplary. It's a small program. But I think because of the hardships that you have to go through to go to school in the Gambia, people are striving harder, is my impression. People have limited resources, so they have to work harder. People's commitment to making the world a better place is sincere and hardworking.
The project is expected to take a 2-year term, and if fruitful as expected, the UTG will benefit from numerous projects and academic support from the Iowa University, and that will help boost the standard of the country's highest learning institute. For Grts News, this is Babukar Senghar.
The Banjul House Harriers recently donated a sum of $50,000 to the German clinic in Dipakunda. The sum is meant to contribute to the purchase of medical items needed by the clinic to perform reconstructive surgery in the country. Ibrahim Jata has the rest of that story.
With no charges attached, the ASB clinic received another batch of expert German surgeons who performed reconstructive surgery on many people with physical malformations. The specialists concentrated mostly on children born with abnormal teeth and mouth closure, otherwise called cleft palate in the medical world. The operation has to be conducted at an early stage in a child's development in order to avoid speech deficiency. The nurse in charge of the ASB clinic revealed that thousands of patients are treated annually. Most of these, he said, are focused on the prevention of malaria in pregnancy and in children under 5 years. He further revealed that the sum donated by the philanthropists would help to cut expenses during operations of patients with malformations.
90% of the operations are free. Even those which are charged, the cost is not for the doctors. The cost is just for the materials. You can imagine somebody who is operated over 6 hours. If you want to, calculate it and in monetary terms, it's well over 60,000. So, and it's a kind of operation which cannot be done here. And then this is done free for the individual, and many like that have been happening, you see. And then we use very expensive materials, especially the sutures we use. So this money can cover that with so many other things. And these doctors are coming voluntarily, and then we are not paying them. They are paying their everything, even their own food, you see. But the little thing we are doing them here, for them here, and then the transportation and the cost of materials, this money could be virtually used for that.
Purchasing materials to conduct surgical treatment is becoming increasingly expensive, which makes the donation entirely well-timed for one of the only clinics delivering expert services for special cases, especially affecting children.
Today we're here to help this organization to carry on with the materials they need to do the operations. We also thank the doctors on your behalf, on everybody's behalf. The camera will scan around later to see how crowded this place is. We've had a walk around the hospital and we've seen the very, very good work that they are doing. What we would call impossible and very expensive. With that, I would like to hand over our donation of $50,000 to Mr. Buba Jadama on behalf of the PDS.
Thank you so much.
Thank you very much.
It's a pleasure. I'm so happy. Thank you very, 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 very much. And thank you a million times.
You're more than welcome.
That kind of good gesture will continue. Thank you so much. We are so pleased.
A mother whose child underwent a successful operation expressed profuse gratitude to the German surgeons for lifting the health standard of her child. This is incredulous. My child has been suffering for a long time, she told the state broadcaster. The management of ASB Clinic thanked the donors for the laudable gesture and assured that the money would be appropriately utilized to support the center's surgical treatments. Ibrahim Ajata, GRTS.
We'll be back with news from outside the Gambia after this break.
Lucozade Energy, energizing Gambia.
Welcome back. France has announced plans to reduce its military footprint in Mali as the fight against militants enters a new phase. The move, according to French President François Hollande, would take effect in early March. Despite that announcement, French troops are still clashing with insurgents in the city of Gao. Let's look at this report for more on that situation.
The number of French troops currently in Mali, about 4,000, will be reduced beginning in March. President François Hollande made the official announcement at a cabinet meeting Wednesday in Paris. But Operation Serval is carrying on for now with airstrikes and ground assaults. In the region of Gao on Tuesday, French troops engaged in firefights with Islamic radicals.
There were rocket strikes from remaining jihadi groups around Gao. This war has allowed us to gain ground against these groups, and we will continue.
In 3 weeks of fighting, Paris says that French troops have killed hundreds of Islamic radicals in direct combat or in aerial bombardments. And tracking down the radicals is continuing. French and African troops are stepping up patrols of towns and cities in the north of Mali. The Tuareg separatist group, the Azawad National Liberation Movement, has proposed to fight with them in zones it controls, taken from the jihadi radicals.
There is a brigade, or in fact an army, that is moving towards Meneka and the entire Kidal region.
The deployment of MNLA fighters in the Kidal region is a strategic move. Their presence on the ground should give Tuareg rebels more weight during political negotiations. Inter-Malian talks are being encouraged by the French and in theory should take place after the current military phase.
Human rights groups have condemned the sentencing of a Somali woman to 1 year in prison after a court found her guilty of insulting the Somali government. The Mogadishu woman was accused of giving false testimony. And US President Barack Obama has called on Kenyans to avoid a repeat of the bloody unrest that erupted after the last general election in the East African nation. Kenyan voters are bracing for March 4th general election amid fears of ethnic tension. We have details of those stories and others in this news roundup.
The trial of 7 members of Côte d'Ivoire's Republican forces opened this week at the military court in Abidjan. The trial is the result of a wide-scale investigation into racketeering. Hearings for 2 of the accused, a soldier in the Republican Guard and a sailor in the Navy, were heard on Tuesday. The men are charged with fraud, illegal detention, and the illegal possession of arms and marijuana. If found guilty, they face 8 months in prison without parole and a fine of 100,000 CFA francs. A woman has been sentenced to 1 year in prison by a Mogadishu court for insulting the Somali government. She was convicted of giving false testimony after she accused Somali security forces of having raped her. The radio journalist who interviewed the woman was also sentenced to 1 year, although the interview was never broadcast. The woman became pregnant after the alleged rape. The court said her sentence would be delayed so that she could wean the child. The United States, United Nations, and human rights organizations have condemned the verdict as politically motivated. There are fears in Kenya of a new outbreak of violence in the run-up to the March general elections. Yesterday, U.S. President Barack Obama called on Kenyans to avoid the unrest that marred the 2007 elections, in which more than 1,000 people died.
We all know what makes for successful elections. Kenya must reject intimidation and violence and allow a free and fair vote. Kenyans must resolve disputes in the courts, not in the streets.
The re-election of President